With me in studio, Dr. Joe Congeni from Akron Children's Hospital with us. Good morning, Joe.
Hi, Ray.
How are you?
Great.
Missed you last week.
Yeah, that's right.
We let you have a week off.
Oh, I got to be with my grandson.
Good
what
for
a
you.
great time. Thank you.
Yeah. Okay, so let's talk a little bit about Tua, Alabama, dislocation of the hip.
Hip dislocation.
And before that, he had high ankle sprain problems. Many people thought he came back early from that, but he went out and played pretty well against LSU, even though you could see him limping. So get into this injury and if that ankle had anything to do with the hip.
Yeah, I knew you'd get right to the heart of the question. But, gosh, Tua this year, Tagovailoa he's like a tutorial in sports medicine. I mean, there's so many things that we've talked about it a couple of times. But hip dislocation, traumatic hip dislocation in sport, very rare injury, not seen very commonly. 30-plus years on the sidelines and courts all over town. That's what I do. I've seen 3 of them in my entire career. They're very, very rare. They're one of the very few things that's an orthopedic emergency. With head and neck stuff, you might rush out on the field to get to an athlete. But for most musculoskeletal orthopedic things, it's not an emergency. This one is really important to get started on treating them right away.
Why is that?
You don't drag somebody out to the sidelines and just let them sit around for a while. You get them to a squad, to a hospital as soon as you can. And exactly the reason why is early reduction of this dislocation it has much better outcome and less chance of complications. The complications of hip dislocation are very bad. There are things that are really, really bad, unlike other ones. So the very common dislocation, shoulder dislocation, kneecap dislocation, patella, finger dislocations, we see those all the time. Hip dislocation, wow. In sports, not very often. It occurs more like in a really bad car accident or something. The ligaments around the hip joint are so strong that the hip just does not pop out very often, doesn't slip out of place. And so if it stays out too long and we don't get it back in place, it has a high incidence of, number one, a thing called avascular necrosis, which is a compromise of the blood flow. The blood flow doesn't get to the head of the femur bone, and we often get the bone dies and need to have it remade. We need to put a new hip in, a hip putting a hip in. We sometimes have, the other complication is a sciatic nerve injury. So sometimes there's a stretch or an injury to the sciatic nerve, especially because 80% of these dislocations go posteriorly, backwards into where the sciatic nerve. So the sciatic nerve either gets injured sometimes, and maybe as high as I was reading last night, 15% rate of avascular necrosis, decreased blood flow to the femur, and so these are big problems, and long-term, a much higher incidence of arthritis later on. So this really is a big deal. About 80% of the time, for some reason, it's in males versus female athletes. And one thing that really surprised me, the biggest study that was done in the last 10 years that looked at the biggest number, skiing and snowboarding is number 1, football is number 2, rugby is number 3. Really, a high-velocity collision is normally what it takes to get a dislocated hip. And a real high incidence of needing a hip replacement later on. So it's a bad actor, and it's one very, very painful too. Usually the people are really crying out in pain. I heard Saturday the sideline reporter said it just seemed like Tua was in so much pain when they got him up on the cart and stuff. That's been my experience in the 3 cases I've had too. Very painful.
Couple of things come to mind.
Yeah.
One, I wanted to talk about his high ankle sprain. Yeah. Him limping around and walking that way, if maybe through your experience that could lead to another part of the body, quote, hip, being a little bit weaker.
Yeah, I think we all could see in the LSU game. We said the week before here we were going to keep a close eye on that because that was really a short time after surgery, and that's not something everybody's doing for high ankle sprains. I mean, I'm getting questioned about that all over the place because we see a lot of high ankle sprains, and that's not the norm. So he limped around a little in the LSU game, but did perform pretty well. Was limping a little. I actually had this game on while I was working out and saw this game. So I think the altered gait, you have to think, had something to do with this. nervous. They're running differently. They're trying to protect a different part of the body. And we see this in sports injuries sometimes. Then you go on to injure another part of the body. Not necessarily and specifically the hip dislocation, but almost any other injury. And it's why once you have one injury, trying to get back, a little bit sooner with that, you end up with another injury of another part of the body. And so I know there's a lot of debate and discussion going on about that, and I have to really wonder about that myself. I really do believe that probably had something to do with it.
I have a couple more questions on this, if you don't mind hanging tight here. Joe, let me ask you this. When we talk about a hip dislocation, is that a front trauma hit? Is that wear and tear? Is it both?
No, it's definitely, I talk wear and tear with you all the time. This is a traumatic event. This is a one-time blow, and it's not from necessarily wear and tear. And of course, what's on a lot of people's mind is one of the great athletes of all time that had a hip dislocation.
My next question.
What's that going to be?
Is this similar to Bo Jackson?
Yeah, that's the problem.
Okay.
That's really, you can't name a lot of them that occur even in the high velocity of NFL football and stuff. And hip dislocations just are pretty rare. They're rare in our world of high school and junior high. They do occur. I've been to a couple, but not very often. Even in the NFL and the highest of velocity, it's a very rare injury, and it is fairly similar. And unfortunately, again, that key is the early reduction. Get them to an emergency room with whatever means they need to get that hip back in place, because it does have that high incidence of losing its blood flow, of going onto the bone dying, of needing a hip replacement and things like that, which really is the end effectively of a young athlete's career.
Well, we're 25 years down the road in regards to medical science from Bo Jackson's injury, but basically that injury ended his athletic career. I'm not asking to make a prognosis on Tua here, but as medical science advanced in the treatment of this particular injury, and if so, could he come back at another level and perform?
Oh, I definitely think he can come back. There's no question about it. And there's no good way for me to know, except that now everybody knows that with an injury like that, you get them to the right facility as soon as possible that can deal with that, which all seems to be the case with him. They were on that in a hurry. They got him treated. They got him operated. I believe it was the next day. And so I think he has everything in his favor to do very well, and he's such a great young man. We're all really rooting for him. But it does tell you that there are a few things out there that are orthopedic emergencies that we really need to pay close attention to. And if something like this happens, you don't have somebody sitting around on the bench for a while, send them home to sit on their couch for a while. You've got to get this thing reduced in very short order to avoid those bad complications we talked about.
Great visit, Joe. Thanks for coming in.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congeni at Akron Children's Hospital. You'll see him on the sideline, by the way.